you. So welcome everyone to our September general membership meeting. We've got an action-packed agenda today. Super grateful to have Kelly Kinnison and Irene Augustin. They are two new staff in leadership positions at the King County Regional Homelessness Authority, here to introduce themselves and have a conversation with us today. We've also got guests coming from the She Clinic at Aurora Commons to share resources and their reflections on new Seattle legislation with us. And then we've got a whole lot of coalition announcements to share with you, including I'll talk a little bit more about the soap and soda ordinances that just passed in Seattle on Tuesday. You may have seen those in the news. And then we've got a whole lot of trainings coming up to share with you. So that's what we've got for you today. And I will invite a volunteer to read our mission, vision, and values. If you would like to do it, go ahead and unmute yourself.
We mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Our vision is a region that acts on a shared sense of responsibility to ensure that everyone has a home. Our values are equity, justice, and collective action.
Thank you, Barbara. Appreciate you. And with that, I will also share before we kick it off to Kelly and Irene that we record these meetings and we put them on YouTube. So if ever you want to revisit a meeting or if you missed something, you can find those on our YouTube channel and we'll post that link in the chat. So with that, I will hand it off to Allison to introduce Kelly and Irene.
Thank you very much, Hallie. One other note that we like to mention for people is these are public meetings. Thanks to the coronavirus, we are meeting virtually rather than in person. However, we really like to try to replicate the in-person culture that we developed for many, many years. So welcome to everyone who's able to turn your cameras on. Thank you so much. Gives us more of a sense that we're here together, even though we're not able to feed you the snacks and excellent coffee that we usually do. And also just a note, these are public meetings, and as Hallie just noted, the recording is shared on YouTube. So if there are any journalists here, you are welcome, of course, to be here. We ask that you please not quote somebody who isn't speaking unless you contact them and get their permission. We're trying to make this a space where folks can ask whatever questions or share whatever feedback they have. And we also, of course, recognize that these are public spaces. So thank you so much to everyone for joining us this morning. We meet on a regular monthly basis. We have a wonderful range of people who come to these membership meetings, from frontline staff to program staff, agency directors, first responders, government partners, people who are in allied community settings. And we want this space to be a space that welcomes and encourages all of you to engage with each other and with us. And we also like to prioritize folks who are in the direct service role when we invite people to ask questions or kick off a conversation. It's my pleasure to welcome Kelly Kinnison, who is relatively new in her role as the CEO of the King County Regional Homelessness Authority, and also to welcome Irene Augustin. Irene, I should have asked you to help me make sure that I'm pronouncing your last name correctly, so you'll correct me, I hope. Irene is the new Chief Program Officer for the Regional Homelessness Authority. They started on the same day. I had the pleasure of sitting down with them in person on day 6 for both of them. They're a few weeks further along. We know and they know that they're coming into these extraordinarily important roles in our community with, among other things, a mandate to get out into the community as they're doing with us today and build relationships, listen, and also get an awful lot of important work done. So in the spirit of that real dig in on a real basis, build the partnership as we're doing the work together, we're welcoming both of them for, really an introductory conversation this morning for you all to get a chance to hear from them directly and get to meet them as colleagues, and also for what we hope will be the first of many substantive conversations with this community around the work that we are engaged in doing together. So with that, I warmly want to welcome both of you, Irene and Kelly, give you each a chance to introduce yourselves to our current meeting attendees, and we'll have about 20 minutes, I think, for a little bit of conversation and maybe some questions and answers. Please feel free to unmute yourselves and tag team as you wish.
Thank you so much, Allison. It's wonderful to be here with everyone. And I hope that those of you who we haven't had a chance to sit down with in person, that we get that opportunity really soon. I too really thrive on those in-person relationships, and also understand that this is a really great way to convene a large group of people who have very, very busy schedules. So I am Kelly Kinnison. I want to tell you a little bit about me, and then I would love to have Irene introduce herself and tell you a little bit about her as a person. And then we're happy to kind of tell you what we're working on and take any questions that you might have. I know we don't have a ton of time today, but as Allison said, I really appreciate this chance to just have this introductory time with you. So I'm a Midwesterner. I grew up in Ohio and went to school in Ohio and Kansas City and Chicago, and then made my way to DC to do federal policy work, first at USDA with SNAP at the Food and Nutrition Service, and then moved over to Health and Human Services in the Office of the Secretary doing human services policy work. And loved DC, really thrived on all the learning I had to do there. And I think was ready to get back to being deeply community engaged, which you're not at the federal level mostly. So when I saw this opportunity, just saw how some of the things that I'd been working on could come together and be really helpful in bringing us together as a community to address the challenge of homelessness. And so I really appreciate how folks have been welcoming and really open to sharing information. I know this is not your first rodeo, and there are a lot of people knocking at your door all the time, asking you for things and maybe not being conscious of what they're giving back. And one of my goals for our first year is for you to see how your input is shaping the future of KCRHA and how we're moving forward, and that this time is really so valuable to us, and that you'll know what we do with it. So with that, I'll turn it over to Irene to just do a brief little personal history.
Sure. Good morning. My name's Irene Augustine. I use she, her pronouns. I too am a Midwesterner, born and raised in St. Louis, Missouri. But I've also traveled and lived in various places. And I guess more importantly, I'm a social worker by background, but have a lot of experience both in nonprofit and the public sector. And so I like to kind of pride myself that I probably have done or been associated with every part of the homelessness response system, from prevention, diversion to outreach and housing. And I'm really excited to kind of bring the work that I've done and in different cities to the work here in Seattle in improving our system and helping people experiencing homelessness get connected to housing and services as quickly as possible. The first 15 years of my career were spent in nonprofit. I was working for largely Central Arizona Shelter Services, doing fundraising for them, and they were the largest emergency shelter provider basically in the state of Arizona. I moved back to St. Louis, that's where my family's from, to help my family through some challenges, and worked and led a drop-in center in St. Louis. Somehow that caught the attention of the city, and I made the leap into the public sector as their chief program manager for the city of St. Louis, and ultimately as the director of human services. But my heart was really in working with systems. From there, I made the leap to San Francisco to head their coordinated entry and problem solving division. And 2 weeks after I started that job, we went into COVID. So definitely, I understand that time and how chaotic, but I also understand what we learned from having to deal with COVID. As a system, I was responsible for 25 shelter-in-place hotels, which sheltered around 5,000 individuals. And so I know firsthand how hard it was to set those up, but then also taking a critical look at our system to figure out what changes have to be made. That caught the attention of Baltimore, and so I went from West Coast to East Coast working for Mayor Scott with the city of Baltimore, really helping with system improvements there. And fortunately, we had ARPA money and CARES Act funding to help support that. But we asked those critical questions about shelter, congregate versus non-congregate, and then access to housing. And today I'm now in Seattle. So I bring a diversity of experience, both within direct practice social work and also systems change and experience from different cities. But what I've learned out of all of this is that, with every city, while we all get federal, local, and state money, the experience in different cities is different. And so it's important to tailor our system with what is going on locally within our community. And in my position as Chief Program Officer, it's really taking a critical look at our homelessness response system, our coordinated entry system, and making sure that we make the appropriate improvements so that we're not only getting people connected to housing, but getting them there as quickly as possible. And so I will be working with all of you, all of your organizations. I've only been in Seattle for a month and a half, but I'm quickly learning a lot. And I appreciate those that have invited me to tour or meet with them, because that helps me to better understand the community ever so much more. And so I look forward to probably one day meeting with you or visiting your organizations. And I also want to say thank you so much for the work that you're doing. I know the last few years have been difficult, and many times we don't get the recognition or the acknowledgement, but I see it. I see you, and I look forward to working with you so that we can continue to improve the lives of the people that we serve, and truly get to the point where we're reducing and ending homelessness here in Seattle, King County.
Thanks, Irene. So if we have a few minutes, I'd love to tell you what Irene and I are thinking about right now and just get your input and questions as we have time. As you know, we've been through a lot of change recently, and a big piece of that is taking a pause as we are transitioning leadership and thinking about what we've learned from our startup phase. A lot of that is through feedback from you and our successes and the deep challenges that we face. And also getting clear with our partners on, what KCRHA is funded to do and who we are as an organization, and then what other roles there are in the system and sort of who is holding responsibility for those roles. So if you've followed the interlocal agreement discussions at all, you know that we are moving toward a different kind of board system where there are, the proposal is to have 9 elected officials, 3 from each caucus, King County, Sound Cities, and Seattle, and then 3 experts with lived experience guiding KCRHA. And I think they've been the folks who have been shaping the ILA agreement have been really clear that our role is the emergency response system. And our future is not in doing any direct service provision. Our ideal role, I think, is bringing folks together to think about the system broadly and then executing in our lane and facilitating conversations with all of you and your expertise around what the gaps are, where we can invite other partners to the table, and what continuous improvement in our system looks like. So we are focused primarily internally right now. There's a lot that we have to put in place to participate in our community in a way that we earn your trust and are a really credible agency. And so we're working on those pieces, which include our financial management, grant management system, having data available to the system, coming up with training and program guides that the community has asked us for, and just doing deep community engagement in an ongoing way and building capacity to do that, because as we all know, that takes time, and it's a really important investment that we make internally. So all of that should lead to us making just better data-informed decisions and knowing where accountability lies for which decisions, and being able to step into that again with credibility with you all. So I've done a lot of listening sessions with our staff, and we're hiring a lot of our senior leadership. We're filling out our divisions around our core business and really focusing there on what it takes to execute our responsibilities around the grants and contracts that we have, and community engagement, and being able to report out data to the community and about the system. So that's really where our renewed sort of interest is in building out. And so you will see some positions being posted, which is very exciting. We're moving along, and we have a little bit more change management to do with staff, which of course during transitions like this we always have. And so we've heard the call loud and clear for an org chart, and we will have that very, very soon to share out with anyone who wants it. And we are also happy to let you know who you can contact for questions that you have around the different pieces of your work that you need to be in touch with KCRHA about. And we're continuing to listen and visit and learn. I think we're 6 weeks in, Irene, maybe verging on 7. So just starting to maybe understand what we don't know, which is a really important milestone in learning, right? Once you realize you know what you don't know, I think is a point at which you're kind of getting really effective. So we're both striving to get there sooner rather than later, and again, really appreciate what you all have contributed to that. Irene, do you want to talk about what you're focused on in the programs division?
Sure. Really covering what Kelly said, there's work we're doing internally, and this is around some significant functions within the program division, and ones that we work collaboratively with compliance and finance. And so it's making sure that we have processes around procurement, contracting, invoicing, and monitoring. And one that is something that we all understand, because I know contracting can sometimes be daunting, but it's important in terms of when we contract with our providers that we understand what the expectations are and those objectives and goals that we would like them to meet with the funding that is provided. What complements that work is the work that we're going to do with our community. And so I'm working very closely with my staff because we want to engage with our community more so than we have been in the past, but in a way that helps us to really frame the work around our services. And so I think a lot of times you hear, what are our standards around shelter and rapid rehousing or permanent supportive housing, which are important and are definitely important in contracts. But I think where we're taking this really a step further is working with our community to co-create that. And so what I'm preparing my staff to do is, how do they facilitate meetings and provide a supportive supporting role in terms of having these community discussions around what those standards should look like moving forward. And so we're working hard to get that infrastructure in place. What I don't want to have is to bring communities together and there's like, okay, great discussion, but then what? And so it's really important to set up a structure so that you have the discussion and you can work towards implementation. And so I'm really working with my staff to help them to understand that role, because it's very different. It's something they don't really teach in college or school, but it's really important to be able to facilitate those discussions and then get to a place where we can move forward together. And then it's really taking a deeper dive into our system, not only looking at our homelessness response system, but even taking a more critical look at our coordinated entry system and being able, one, to understand our current system, and two, to be able to make the necessary improvements so that we're housing people as quickly as possible. And that leads to those discussions about housing. And so how do we bring other partners into this work? It's more than providers, it's other sectors. And I think it's really important that we understand our roles and responsibility when it comes to being able to serve people at risk or experiencing homelessness, and to make sure that we understand who does what. And that will help better inform our system so that, you know, as we start to hopefully house more people, if we ever see a hitch in our system or a glitch in our system, we can more easily address those. But, you know, going back to being a social worker, I firmly believe that the system has to be understood by all people. If I don't understand the system as a social worker, how do I expect someone who's experiencing homelessness to understand that? And so it's really all of us getting on the same page and being able to move forward. And Allison, I think we're probably at time, but you probably have a question. So.
Oh, thank you so much, Irene. I didn't want to interrupt, but you are right. We're getting close to time. I think that's a really wonderful and often overlooked point that you've just made. So maybe it's a good transition point to note that is one of the things that I think all of us hear and experience, which is it is an incredibly complex system. Attempting to get people the help they need is far more time consuming, protracted, and hard to understand than it should be. And a fundamental reason for that, as I think we all are painfully aware, is the drastically inadequate resource compared to the need in our community. So we have more people not in shelter every day and every night, even after our thousands of shelter and transitional housing beds are full. And that is the fundamental problem. We need the housing. We really understand that. And one of the things that I've spoken with Kelly and Irene about, you know, as they're underway, is there is huge pressure and tension always between the people who believe that efficiency can shift things and the people who understand that while there may always be ways to improve and make more efficient processes, that is not the problem with the homelessness crisis response system. And so we as advocates and you all as administrators of the system have a really important set of educational conversations to press forward on. We we know this is not the only time you're going to come and join us. We really, really appreciate both of you, Irene and Kelly, taking this time. I think coordinated entry is a top of mind issue for many, many folks on this call. And maybe so that we don't put you in an awkward position of trying to answer questions when there really isn't time to do so, I would just like to take a couple of minutes and invite people to put your questions in the chat, knowing that, you know, this is an ongoing process. Irene and Kelly both have, I believe, other things that are probably going to take them away from the rest of this meeting this morning, but they are coming to our senior leader meeting tomorrow, and we will work with them and their colleagues to create some more space for real dialogue and question and answer. So feel free, folks, to put some questions in the chat. I asked Lisa Edge, who's with us also from the Regional Homelessness Authority, to share information that there is a central phone number now, and that Lisa puts out a really informative electronic newsletter. And so I asked Lisa to share that info in the chat, because if you're not connected to those two resources, please add yourself. And with that, I think we just want to thank you both again, Irene and Kelly, for joining us. This was a welcome intro, and we know there is a lot more to come. And we look forward to working with you.
Thank you so much. I do have to hop to another thing, but I've really appreciated this time and look forward to seeing you again.
Thank you, Kelly. And Irene, if you're able to stay, you are most welcome to do so. We will share the questions and the comments that folks might be sharing in the chat with both of you. So we have, as Hallie said, a rich, full agenda. And I believe that we are next going to turn to our colleagues from Aurora Commons to talk both about the special SHE clinic work that happens in that community, and also a little bit about the intersection with the advocacy work that they and we have been involved in related to the proposed and now law banishment zones that are going to affect a lot of folks that we work with and care about. So Hallie, I turn to you and to Elizabeth and to Maggie, and I look forward to hearing this part of the agenda. Thanks.
Yeah, thanks, Allison. So we've got Dr. Maggie Green from UW Medicine, who helps run the SHE Clinic at Aurora Commons, and Elizabeth Dahl-Helendi, who's the Executive Director at Aurora Commons, with us today. And I'll turn it over to, I think maybe we'll start with Maggie to talk about some of the clinical services available at the SHE Clinic, how people can get connected, and what has helped them be successful.
I think we decided to have a last minute change because I think our clinics activities are so closely entwined and dependent on what's going on at the Commons. So better for you all to understand what the Commons is first and what they're doing. So Elizabeth, please.
Yes, thank you, Maggie. So I'm just going to give an overview of Aurora Commons. I'm really grateful to be here. Thanks for having me. And then we'll pass it back to Maggie to talk about the SHE Clinic, and then I'll share about some of the work we've been doing surrounding the legislation. So Elizabeth Dahl-Helendi, I've been at Aurora Commons for 12 years as a staff person. In January, it will be 10 years as the executive director. It's the longest I've been anywhere. So Aurora Commons is a nonprofit located on North Aurora Avenue. Our mission is to cultivate community and belonging to foster health and healing among our neighbors experiencing poverty and homelessness. So we do that. Our focus is on cultivating community and belonging first, because we believe that is where health and healing starts for folks. And so we make sure that our staff are kind and friendly and welcoming to everyone that comes in. That's our heart, is for people to feel like they belong and that they're seen and that they're valued. And then from there, we offer many basic needs and resources for people so that they can either rest or access next steps. We don't prescribe people's journeys for them. We provide a safe space for people to rest and relax. And if they are seeking resources, we have an advocacy team that they can connect with. So some of our basic needs that we provide are food, clothing, hygiene, wound care, like things like bags and so occasionally tents and sleeping bags and things like that. It depends on what we have on hand. We don't always have tents and sleeping bags, though we often do. So that's the basic needs side. That's for drop-in. We have a clothing closet. We also have basic household items for folks if they get into housing or need specific things like bowls and plates and stuff like that. We have a bunch of that. And then if someone is seeking more than just coming in, having a cup of coffee, we also always have really good coffee and cream. We believe that cream is a value of the Seattleites, and it's one of our main values that we make sure we always have real cream for folks. So that's a drop-in side, and that's sort of people come in, they have food. You usually have hot meals 4 days a week, Monday through Thursday while we're open, and then coffee, and they can hang out. And the Commons is intentionally a space that feels welcoming and is beautiful so that people can come in and feel like it's a living room. We lovingly call it a neighborhood living room. We want people to feel like they're home. If they don't have one, that they can just relax and sit in a comfy seat and have a cup of coffee and not have to do or be anything. And so then if someone is seeking other services, we have an advocacy team, and our model is unique in that it is drop-in advocacy or drop-in case management. So that means that people come and can usually talk to someone the same day. That works if you come early enough to sign up. We're right now having to pull our list of signups earlier and earlier because of how many people are requesting support. We see about 20 to 30 people for advocacy a day. And that's with pulling the list after about an hour and a half of it being open. We serve about 200 people a day, 160 to 200 people in our space a day, which is pretty remarkable for how relatively small our space is. And so one side is really kind of the cafe drop-in side, and that's sort of basic needs, resources, things like that, food. And then the other side is the advocacy clinic side, and kind of it's also like a little bit of a living room area where people can hang out. And so we have a resource navigator, and when someone comes in and they're seeking resources, they go and talk to the resource navigator, and they say what they need, and then the resource navigator can either put them on the advocacy list to talk to someone, to sit down with someone to talk to them, or they will give them, say, that's something that we can't actually help with, or they'll give them some, resource book or something. They're kind of like triaging the need, and so they'll connect with them and get them on the list. And then our advocacy list is prioritized mostly first come, first serve, but also by emergency level. So a lot of folks that are having really serious emergencies will be prioritized, kind of like the emergency room, emergency department. And but for the most part, folks that, if folks come and they really want to be seen and they get there early enough, then they'll be able to talk with someone. And I think that's a really, really unique model for this population, especially for case management, for folks that don't sometimes, it's challenging to make an appointment when you don't have anywhere to charge your phone, you don't know what time it is. And so the advocacy side is, we have a group of, I think right now it's 5 advocates, and then 2 of the team of advocates right now, actually 3 advocates, are focused specifically on gender-based violence. So that is commercial sexual exploitation, sexual assault, and domestic violence. So that advocacy team, the gender-based violence team, we're funded through the city of Seattle for the mobile flexible advocacy. And some of the services that we can provide, both on the advocacy, client assistance, or both on the gender-based violence team and the community advocacy team, are connections to resources, a listening ear, and then client assistance. So we have fairly robust client assistance access for folks. So, and we have, because the client assistance, especially for the general population, is not funded through a grant or a contract, we don't have a lot of red tape, so we can be creative with how we help people. And that's pretty unique for a lot of folks who are needing help, like busting their ferret out of ferret jail. We've done that before. There's a lot of ways that we help people that are unique to the Commons. I don't think other folks aren't doing that, but that's one of my favorite stories of how we've used some of those funds. So the other thing that folks can access as they come into the Commons is, and we also have evening drop-in. So we have Monday night is called Men's Night. It's for male identifying folks to make food together, hang out, spend time together. And then Wednesday nights is Women's Night, which is female identifying women's drop-in. We know that with most of the women that access our services are either actively in the sex trade or at risk of being commercially sexually exploited. And so we, in journeying with them for as many years as we have, which is 13 years, we've found that if they specifically feel safest and most able to relax and access resources when there's a space and time that's just for them. And so that's why we have evening drop-in on Wednesday nights for them. And then it was through those relationships and journeying with this population and with a robust needs assessment and a pilot project for the She Clinic that we launched the She Clinic in, I think it was, Maggie's going to have to take this part.
Yeah,
the She Clinic
2018.
2018. Okay.
Yeah.
So I'll pass to Maggie to share about the clinic.
Yeah, hi everyone. Again, I'm Maggie Green, and I'm an infectious disease doctor at UW Medicine. I work both at Harborview, or out, kind of based at Harborview, as well as at UW Medical Center Northwest campus, which is right up the street from the Aurora Commons. And I got involved in the She Clinic I think we opened in July of 2018. Initially, it was a one day, one afternoon, a week clinic, and we have now expanded. So we'll talk a little bit about that. But She Clinic is for, female identifying people that can access, basically primary care on a drop-in, sign-up, walk-in basis. Meaning we do, there are four providers that rotate, and we have been doing this all together for the last several years. We have a nurse and we have a social worker, and everyone is there to try to provide trauma-informed harm reduction medical care to people, primary care and specialty care to people who weren't otherwise really able to access it. So most of what we do is a lot of HIV prevention and testing, a lot of testing and treatment of other sexually transmitted infections, but also management of diabetes and hypertension and wound care and really whatever people have on their agenda for that day. So we are seeing patients that we prioritize seeing women on Wednesdays and Thursdays. And then we got funding for what we call the Aurora Clinic, but it's basically the same idea, on Mondays and Tuesdays. So women can access care Monday through Thursday, and men can also access care on Mondays and Tuesdays. The idea is that, again, as Elizabeth mentioned, a lot of women don't come around when it's not sort of a prioritized space of women only. And so we really try to keep Wednesdays and Thursdays, we try to keep the space open and friendly to mostly women, although if obviously there's an emergency, we're going to take care of it. We also, being a UW clinic, so we're sort of run out of Harborview, we have access to all of kind of the specialty needs and imaging and everything that we would need for UW medicine. So, you know, we can sign patients up for Medicaid the same day and then get them seen and get them appointments at specialty services. We also do, you know, opiate agonist therapy for people who are interested in that. And we have a relationship with the Harborview LTC pharmacy that, you know, can deliver medications to us the next day. So people can come and get a prescription, and instead of having to go to the pharmacy and pick it up, they can just come back the next day and pick up their medications from us directly. And that certainly helps for people who have a lot of complex medical needs where they might need a little bit more time to go over things, make sure they really understand it, and everything is packaged in, you know, simple packaging for, you know, to improve adherence. So really kind of full spectrum primary care. You know, reproductive care is a big issue for this population. And we've been very grateful to develop a close relationship with the UW primary care Thornton Creek, which is at Northgate Clinic. That is the home of family medicine practice, and they have been wonderful in accommodating our patients, you know, a same day or next day for patients needing reproductive care. I see a question in the chat. Are we able to long-acting MAT? No, we can't. We don't have Sublocade yet. I think when patients need that, we end up referring to WeCare, which, you know, is just down the street. But everything else we can offer. Are there any questions about what we offer? I feel like that's just our general overview. You know, we generally see patients from 10 to 3. We really want to kind of at least meet everyone. And I would say that it's not uncommon for us to see 1 to 2 brand new people every week. And then a lot of people who have come back to see us even after they've gotten housing, which, you know, means a lot to us because we've developed such great relationships with them, but also, you know, hoping that at some point they would be able to access kind of more standard medical care where they'd have appointments and things like that. But we're really here for the people who aren't. I guess as part of our advocacy too, we're really working hard at UW hospitals. I do a lot of training at Northwest specifically on trauma-informed care and working with the kind of perinatal group here to change some of our policies and procedures to be more friendly and welcoming to people who, you know, pregnant people who are using drugs, so that we can, because that is often where they end up to deliver, and we don't want that to be a traumatizing experience for them.
Thank you so much, Maggie. A quick question, maybe while folks are thinking about if they have questions about the clinical side. We've got a lot of service providers in the house today. So how can people get their clients or their guests connected if they need with the services offered for folks that are homeless or in the sex trade or living on or near Aurora at Aurora Commons?
We don't take referrals over the phone, and we don't typically so we don't take referrals over the phone. So the best way to do it is for the person to come in. As I mentioned earlier, we see about 200 people a day, and that means that we don't have a lot of capacity to support any kind of official referrals from organizations that are calling for help or support. So we don't do client assistance over the phone or any kind of other referral. So the best thing to do is to be there in person, is to bring your person during, have them come when we're open. We don't turn folks away when they're there in person. We just don't take referrals over the phone. And so as far as the clinic, the SHE clinic, it's the same, really just to come come early. So we open at 10. And if you sign up around that time, you would likely be seen.
Awesome. Thank you so much. And I'm seeing a couple of questions roll in the chat. I'm wondering if, since we're a little short on time, maybe we could address the clinical side questions in the chat. And then Elizabeth, I might invite you to talk a little bit more about, Aurora Commons advocacy around the soap legislation in Seattle before, just maybe for the next 5 minutes or so.
Mm-hmm. Yeah, so we were part of a number of organizations that are working with adult survivors of the commercial sex trade in Seattle. So we are part of a number of different groups with that are serving adult survivors of commercial sexual exploitation. And we, council member Moore is the council member in District 5 now. And so she's our council member over our district. And so we've met with her before she was elected and then a number of times since, and have worked with these groups to educate and to try to create, to support our, what am I trying to say? We worked with groups to, when this legislation was proposed, to make the bill, to amend it to try to reduce harm. And we worked with a number of gender-based violence groups and with Councilmember Moore to attempt to reduce the harm of the bill. So the soap order, the soap bill, some of the wins that we had in working with Councilmember Moore were that it was limiting the potential soap orders to buyers and promoters, and they removed the sellers from the bill. They're requiring the development of training protocols for the Seattle Police Department, working with individuals experienced CSC based, so individuals who've experienced CSC, so it's not just an internal training that they do. And then they also created arrest policies that explicitly stated diversion and referral services are the preferred approach. So that essentially what initially this was going to look like. I mean, what the stated purpose of this legislation was, from Councilmember Moore to saying it to me, was that they were looking to address violence, escalating violence on Aurora. That was the initial state. And now the bill doesn't say that. The bill says they're working to disrupt commercial sexual exploitation. We're frustrated and disturbed by the escalation of violence on Aurora. Our own community members are often victims of the escalated violence, but we maintain that the way to address the violence is to detect who was responsible for the violence, and arresting victims and survivors of the commercial sex trade as a way to get to the real perpetrators of violence is sacrificing real people and very likely causing more harm, as this was shared with us by a member of our CSE peer advisory group, absolutely making their lives more dangerous. The reality is that SPD has the lowest staffing since the 90s. The detective team is roughly half of what it should be. And according to our sources, the North Precinct, which covers more zip codes than any other precinct in Seattle, previously had 8 detectives and its own vice unit, and currently has 0 to 1 detective and no vice unit. At a recent North Precinct Advisory Council meeting, Sergeant from SPD's Gun Violence Reduction Unit reported that the unit has 10 detectives for all of Seattle, while it should have 18 for full staffing. They're not able to look into who is holding the weapons. And so they're creating this legislation to attempt to get to the violence, and they're victimizing people that don't have a lot of choice in their lives out there. So it feels risky as an organization to take a stand in opposition of a bill that appears to be intending to help to disrupt the commercial sex trade for the good of the city. But ultimately, we took a position in opposition because in our 13 years located on Aurora, we can attest that the pathways for people seeking services to exit the sex trade are grossly inadequate compared to the level of people asking for help on a daily basis. And this legislation does not address that. It says we hope to fund. It says diversion is the preferred approach. Preferred approach. They can do whatever they want with the preferred approach. It's not easy to actually vacate your record either of prostitution charges. It can take up to 3 years. There's just, we feel like this. We're not against any legislation. However, this is just feels like it's been done in reverse, where it needs to be resourced. We need to know what the funding is. When the city is facing a $260 million budget deficit next year, you're seriously telling us you're going to resource this? How? And who are you going to take those resources from in order to fund this? And with grossly understaffed SPD, who already have a bit of a chip on their shoulder regarding this, now you're kind of fanning the flame. You're putting gasoline on a dumpster fire, in my opinion. And that's ultimately, we believe that there is a way to have legislation to disrupt the sex trade, but we're concerned about the harms of the real people that we work with on a daily basis that this will cause. And so we felt like we didn't really feel as though we knew how council was going to vote for the most part. We didn't feel like there was a way to change that, but we didn't feel as though keeping our voices silent as one of the only brick and mortar nonprofits on Aurora serving this population, that would be, we wanted to at least show to our community that we are here for them and that we don't agree with this type of legislation as written. So.
Yeah, thank you so much, Elizabeth, for sharing that. I think it's a really important story of your organization both working to reduce the harm of harmful legislation and ultimately having to take a stand against it because of the impact that it'll have on your guests and clients. So thank you so much for sharing that. Thank you, Maggie, for coming to share all of the excellent resources available at the SHE Clinic. If you all are able to hang out, I might invite folks to ask you questions in the chat. And I think, you set us up beautifully for a transition to talk a little bit more about the soap and soda banishment ordinances that passed Tuesday night in Seattle. So Elizabeth talked about the SOAP, or Stay Out of Area Prostitution zone, that's been created on Aurora Avenue north of 85th. Another part of that legislation, which is, in our work with the Coalition Ending Gender-Based Violence, is really a key piece that they're really concerned about, is that this legislation also creates a new a new misdemeanor crime of prostitution loitering. And I'm putting that in like air quotes because it basically, if a cop thinks that you look enough like a prostitute and you are behaving enough like someone who is trying to sell sex, that you can be charged with that crime even without them having to prove the actual sale. So that is deeply concerning. Seattle used to have a prostitution loitering law that was thrown out in, I think it was 2020, because it was demonstrated to be discriminatory against cis and trans women and also people of color. And so we would expect similar results with the similar new legislation, and that is deeply, deeply concerning. A second piece of legislation that passed on Tuesday is called SODA, or a Stay Out of Drug Areas. That piece of legislation creates 6 zones in Seattle where people can be excluded from if they are accused of a misdemeanor drug or drug-related crime in that area. So those areas include downtown, Belltown, the International District, Pioneer Square, the U District, and Capitol Hill. So it's creating this like patchwork of banishment zones across the city for people that have been, again, accused, like not necessarily convicted, of drug or drug-related misdemeanors. So it's really broad legislation. It's really alarming, and we know that it will primarily target people who are poor, homeless, and people of color, and that is really, really concerning to us. We also know that it will make it a lot harder for folks who are trying to seek services to actually like get help. If we're creating this sort of maze around the city of places that they can't be, or that they have to seek a judge's approval to be in, even if they need to go there for housing or shelter or treatment, like all of those things need a judge's approval if they have been given a SOTA order to banish them from that area. So it is only going to make it harder for folks to access the services that they need. And that is just deeply concerning as we move forward. The only upside of this this whole journey is the really incredible work that's been done by the community against this legislation. You might have seen there was a Seattle Times article about it the other day with photos of City Hall just absolutely packed to the gills with folks who turned out to speak in opposition to both pieces of legislation, including, many of our member organizations and allied organizations, including the ACLU of Washington, MLK Labor, ETS Reach, a whole host of people and organizations that really know what it means and what it takes to get people the help that they need to meet their basic needs and to get housing and to get safe and to get healthy, really came out in force against this legislation. We also got the opportunity to work with folks who we don't ordinarily have the opportunity to work with. So Strippers Are Workers did a huge amount of work fighting this bad legislation. And so we've been able to build relationships with them and join them in advocacy against this legislation. Just on our action alert alone that we sent out, we had over 250 people take action, and they sent 930 messages to Seattle City Council and the mayor. So that is just an absolutely huge show of force, and really demonstrates that our community knows that these pieces of legislation are not the way forward. And I could talk about this all day. So Allison, cut me off if you need to. But I think the last thing I'll say about this is just, Elizabeth alluded to this, and just moving forward, the mayor is going to release his proposed budget on Tuesday. And there have been some promises made over the course of this legislation of, we're going to allocate money to help, people who are in the sex trade. That is not in the legislation that was passed on Tuesday. Seattle has a massive budget deficit that they're dealing with. They have not proposed any new progressive revenue. So we are going to be absolutely watching very closely and doing a lot of advocacy around making sure that human services are adequately funded in the budget, and that we can maintain our level of support for folks who are experiencing homelessness. So if you're not already signed up for our action alerts, that'll be our primary tool that we will reach out to you to invite you to take action on the budget. And stay tuned for some advocacy trainings that will be coming up shortly.
Thank you, Hallie. I think one thing that we didn't do is copy the link. So could you perhaps grab the link for people to sign up for action alerts? Folks, I want to underscore what Hallie just did in her transition. So you heard from one of your colleagues, Elizabeth at Aurora Commons. Let's just recognize it is not a straightforward thing for individual nonprofit service and housing organizations to take public positions in opposition to proposed legislation. I think everyone here understands that, and it is part of why the Coalition on Homelessness exists. Look at the organized, powerful, detailed reasons for opposing these bills, now soon to be laws, that was possible to develop in a very short amount of time. The Washington Alliance for Gun Responsibility, national experts, organizations working on commercial sex work and on trafficking issues, the ACLU of Washington, the Sexual Violence Law Center, the Martin Luther King County Labor Council, and many other organizations have publicly opposed this. I want to remind everyone that the fact that these bills were developed without significant community input and rushed through with extremely limited opportunity for public discussion, let alone public comment, is a tactic. So all of you who are here with us on this call, all of you who are part of the broader coalition membership and allied community, here is what that means for us. That is a tactic that is being used to diminish and avoid the earned expertise and practical knowledge, whether you're a healthcare provider, a social worker, a community resident, a person who has experienced homelessness, someone who has participated in commercial sex work. Your expertise and your voice are essential for good public policies to be developed and to ensure that these laws are not implemented in the harmful ways that we expect them to be implemented. That means that we have to be on, and we have to get others to join us. So all the opportunities that we offer for you, advocacy workshops that Hallie is working on in partnership with our colleagues at Poverty Action, and some other organizations, including the Seattle Human Services Coalition. Please show up if you can, or spread the word. If you're an experienced advocate or you want to learn how to become an advocate, those are spaces for you. We try not to flood you with action alerts. We try to only tell you to take action or speak up or show up at City Hall when it's really urgent. The trouble is, there's an awful lot of urgent stuff happening. So just know, you don't have to always respond, although we do try to make it really, really easy with our email action alerts. But you do have to pay attention and broaden the group of people who will be paying attention with you and taking action. We take a look at who sends emails through our action alerts. And I want to tell you, we need more people who live in downtown to take action. We need more people who live in West Seattle to take action. There is a big difference between how many emails the council members who represent those districts get, as opposed to the council members who represent the U District or Capitol Hill get. So you can help us spread the word. Seattle is not that big a city, and King County is a really broad network of people. So that's my pitch to you. This is an advocacy organization, and we exist to help you do the work of bringing your expertise and knowledge forward. And if you have feedback for us, we want to hear it. Not unrelated, my friends, is helping your folks register and vote. Not only is this possibly one of the most important elections in our lifetimes at the federal level, but this is an incredibly important election in the city of Seattle. And there are also really, really important candidates and issues on the ballot statewide. So we are hosting, thanks to Jody Rao and some of our awesome voting rights volunteers, we are hosting a voting rights volunteer training next Wednesday. That's September 25th. It's at the Lake City Public Library. And we want to invite you to come. Barbara is here, one of our awesome lead volunteers with our voting rights work, who has helped, I'd say, probably hundreds of people know their rights, look up their addresses, change their addresses if they need to, update their registrations, but also understand that even if you don't have a stable traditional home address, you can register and vote. Even if you have a previous felony conviction on your record, you can register and vote. And all the folks who are affected by these laws, I'd say over 90% of them are probably eligible to vote, and we need to help them know that and understand the opportunity to have their voices heard, because that's one of the things that we do over time to build power and to shift who it is who makes decisions that affect the lives of people who are experiencing homelessness or housing instability or poverty. So the registration link is also on our homepage, homelessinfo.org. We love doing these voting rights trainings. We have great materials for you to bring back to your programs, your agencies. So even if you're not able to volunteer with us, we invite you to come and bring the info back to your place of work or your community group. And if you want to volunteer with us, man, is that an awesome volunteer experience. It is just really a great feeling to help people understand their rights and how to use them. The civic engagement is really one of the more joyful parts of what we do, even in hard times. So just like Hallie could talk about policy issues all day, I could talk about voting rights all day. We also have 2 case manager trainings coming up. I'm going to turn to Jody to briefly highlight those for all of you, and we will put the registration links in for those workshops in the chat as well. And then I think we're going to move to community announcements for the common good.
Thanks, Allison. Hey, everybody. And I'm just going to put one more plug. It's possible I missed it when Allison said it, but not only do we help folks volunteer to come with us out into libraries, day centers, tent cities, health through housing sites, food banks, we can also come talk to you and your colleagues at your programs. Maybe you saw Karina throw in the chat that she helped register some folks, and we can help support your staff to do that too, if you've got people that are passionate around that. So I'm just going to put that plug in there too. Email me. I'm working with some, I have a family emergency that I'm working with, so it might take me a hot minute to get to you, but I will get to you. So next Thursday, September 26th from 9 a.m. to 11 a.m. we have our Medicare, Medicaid training. This is in partnership with the Benefits Legal Assistance folks over at Solid Ground. These are incredibly smart, resourced, informative attorneys that are going to help case managers, mutual aid, peer supports really understand the nuances of applying for Medicare, Medicaid, what that eligibility is, what resource limits are, troubleshooting the application process, how to maintain those benefits when your guests, clients, and the folks you're working with maybe get a letter saying they need something or there's something amiss, so people don't lose those benefits. It's a really, really great training, and we really tailor this to make sure that you as providers, case managers, mutual aid supports, peers, really can support your folks that have a lot of barriers. And so how to show up and advocate for them, what their rights are, so they know you can really walk alongside them in that process to make sure they're getting those benefits that they are either entitled to or eligible for, as the case may be. So please join us. I'm just going to refer back to our YouTube channel. We've done this series of this over the last couple years, and we like to repeat it just for any changes that have happened through legislation or, around resource limits, but the basics are still usually there. And then on Tuesday, October 1st, from 10 a.m. to 12 p.m., we are going to do our annual helping students experiencing homelessness. And again, this is really targeted to any of you that are working with families, youth, young adults, unaccompanied minors, who are needing to understand what their rights are under the federal McKinney-Vento Act that really lays out a lot of rights around students experiencing homelessness and how schools and school districts, what their responsibilities are. And this is an underfunded resource. That's a common theme for us, unfortunately. But again, we want to make sure that you really understand basic things like your kiddos can go to their school of origin. So if they were going to school in Kirkland and they are the star athlete, or they've got a IEP or whatever it is for, if they have accommodations for their education, they're the student council president, their community is there, but they have found housing in Renton, they can still go to Kirkland. And they should not be missing weeks and weeks of school waiting for that transportation to happen. And that transportation doesn't fall on the student. So come learn about all of that stuff. We've got some resource folks that really support. I'm seeing Team Child. They are usually a solid partner with us in this work. So come learn about all of those rights and resources that folks can access on October 1st with us. We would love to see you there. So I'm gonna, I think, hand it back to Allison or Hallie. I'm sorry, I'm a little out of sorts, and I'm really happy to be here with you all.
No worries, Jody. Thank you very much. Just a quick reminder for folks who may not be as familiar, the McKinney-Vento Homeless Assistance Act does give students and their families specific federal rights in terms of making sure they can access a public school education just like any other kid. However, as Jody said, it is either unfunded or underfunded. So there is a McKinney-Vento designated liaison in every public school district. However, that might be the same person who is also the school nurse who splits their time between 3 different buildings, and so on. So if you are working with folks who kids might be eligible for the public school definition of McKinney-Vento eligible, meaning not only literally homeless, unsheltered, in a vehicle, in emergency or transitional shelter, but also someone who is living doubled up. Those kids may indeed be eligible for various supports, and you as the adult in their lives or as a case manager or social worker need to help understand and advocate for them. So if you have any questions about that, please email Jody or any of us, and we will help direct you. But this training is something we've done every year for the past 17 years to help make sure that you all understand how to support the kids and families you're working with. And unaccompanied minors are also eligible for help, which is a really important part of that law. I think we're moving on to community announcements. We usually stop the recording so that folks can say whatever they need to say. And I know that Laura Harrington from the Seattle Public Library is here to share an important opportunity to attend a public speaking event. And Laura, after you've shared that, I will share something that is happening tonight at the Seattle Public Library that our folks might be interested in. So if somebody can pause the recording, we'll, oh, okay. That didn't seem to work.